moment will remain in our hearts and memories. Thank you so much.
Amazing. Thank you, Dariga. Now, Francesca, can you please tell us how the outcome statements was shaped? What were the asks from the decision makers we have here in the room?
Thank you so much, Dr. Sultangaziev, for the questions, and thank you, Leana, for helping me with the mic. So this statement is a youth-led statement, which was developed in collaboration with the conference participants. At the beginning, a youth-led group, writing group, was put together by the Youth for Health Network, and young people in the group were part of the WHO Youth Council, the WHO Europe's Youth for Health Network. They were UNICEF young representatives, and also members of the WHO Primary Healthcare Young Leaders Network. And this group worked really hard to put together a zero draft in record time. And this draft was then shared with other young people and representatives through one online consultation, where we tried to gather more input, also from representatives that couldn't be part of the writing group because of time constraints. And then the updated draft was shared with the conference participants between the 3rd and the 12th of October. And conference participants could provide their feedback and suggest amendments and integrations. And we are very glad to say that we received more than 150 comments from conference participants, which were very detailed, very precise. So thank you very much for showing this passion and this commitment to the statement. Now, the statement follows the path of the Alma-Ata and Astana 2018 declarations in the sense that it urges for a radical transformation of our healthcare systems based on primary healthcare. The participants to this conference have 5 main asks to policymakers and decision makers. And the first one of these asks is that decision makers ensure equitable access to primary healthcare services to everyone, regardless of their age, sex, gender, geographical location, religion, socioeconomic status, language, or political affiliation. And to achieve this, we call for increasing public finances to primary healthcare. We call for revisiting the model of services to better address intersecting biological, social, and psychological needs through multidisciplinary teams. We call for taking services closer to people in their homes, in their schools, at their workplaces, in all meaningful local community settings that people go through and engage with. And we also call for decision makers to give space for empowering all individuals and communities to take charge of their own health and well-being. Our second ask as participants to this conference is that decision makers commit to enhancing the quality of primary healthcare as the foundation of trust. We envision future primary healthcare-oriented systems in which the quality of care is a crucial commitment to populations and all health and care workers. We also envision compassion as a key driver of a quality primary healthcare system. Our third ask to decision makers is that they invest in a primary healthcare-oriented workforce. And this means, first, including comprehensive primary healthcare education in undergraduate healthcare curricula, and also establishing residency and training programs in primary healthcare. It means decent pay and decent working conditions that protect the mental and physical health and well-being of workers and address issues such as burnout, gender-based violence, and discrimination against healthcare workers. And it also means providing opportunities for continued learning in primary healthcare. Our fourth ask is that decision makers ensure the human and relational aspects of primary healthcare amid the opportunities provided by the digital era. We call for the current digital developments, which include artificial intelligence, telemedicine, and big data, to be implemented as a part of a strategic system-wide digitalization and not as sparse measures. And we call for this digitalization to preserve and enhance the foundational values and principles of primary healthcare, which remain human relationships, trust, and compassion. And then our final and fifth ask to decision makers is that they enhance resilience to current and emerging health and well-being challenges, which are quite a lot, and they include non-communicable diseases, mental health, social vulnerabilities, the impact of the climate crisis, antimicrobial resistance, migration, conflict, and health emergencies. We urge decision makers to transform these emerging challenges into opportunities to design and deliver high-quality, adaptable health services based on the principles of primary health care. I just want to conclude with congratulations really to all the conference participants, because this is everyone's statement and everyone contributed to it into this room. Thank you so much.
Thank you so much, Francesca. What a comprehensive and rich statement. And now is the time to sign the statement, and I would like to invite our dear DG, Dr. Tedros, to be the first person to come and sign the statement and share with us a couple of closing remarks. Please, Dr. Tedros.
Okay, that's good even. Okay. I will line up here then. Okay, Your Excellency, Minister Giniyat, Your Excellency, Deputy Prime Minister Chris Fearne, and my RD and brother Hans Kluge, Excellencies, dear colleagues and friends. Throughout the day, we have heard compelling arguments that in our increasingly complex world, with economic, demographic, epidemiologic, climate, and security challenges, the primary healthcare approach is more relevant than ever. 75% of the projected health gains from the Sustainable Development Goals could be achieved through a primary healthcare approach. This includes saving over 60 million lives and increasing average life expectancy 3.7 years by 2030. Today, just 5 years after the Astana Declaration, we have heard a wealth of important lessons for implementing primary health care and achieving these gains. We have held powerful experiences from countries that illustrate how ambitious primary healthcare reforms can be made even when resources are constrained. Kazakhstan, Georgia, Spain, Latvia, Thailand, to name just a few, are instructive examples of the innovative use of existing resources and how to better link parts of the health system using a primary healthcare approach. They show how political commitment and leadership can translate to real progress on universal health coverage. I commend the youth-led outcome statement, thank you so much, with its powerful call for action, starting with equitable access to primary health care and the importance of meaningful engagement with communities. Our work does not end today. It's only just beginning. Countries can take these lessons to build on them to fit their own circumstances and contexts. Let me highlight 4 priorities going forward. I just going to say the 4 out of all the things that our youth had already said. First, sustainable funding to reorient health systems to primary health care, and for expanding the health and care workforce with quality education, fair pay, proper equipment, and decent working conditions. This goes hand in hand with ensuring that the most vulnerable are financially protected as they access the essential health services they need. This should be seen not as costs, but as investments in social and economic development, gender equality, and in future generations. Second, primary health care does not stop at the clinic door. As was highlighted many times today, it must include health promotion, disease prevention, rehabilitation, and palliation, and strong links with public health. Third, keeping equitable access at the forefront with a focus on marginalized and vulnerable populations, particularly in low-income communities, migrants, and others who have hurdles to accessing quality health services. And finally, as we often heard today, it's vital that we help ensure political leaders at all levels, national, subnational, and local, be fully informed, engaged, and empowered to lead this effort. Building and supporting health and well-being requires engagement from all sectors. WHO stands with all of you and with governments and communities around the world to support you catalyze the transformational shifts towards primary health care. Thank you, Minister Giniyat, Khudarre, and thank you for your leadership, and thank you for the excellent visit and for launching with you the Republic Primary Health Care Center. And thank you also for the initiative, mobile clinics. So impressed. Thank you so much indeed. And congratulations for all that you're doing. Khuta Bulsin Khudarre. Khuta Bulsin means congratulations. So congratulations, Minister Giniyat. Thank you all once again for your commitment to harness the power of primary health care for people in Kazakhstan and around the world. And my appreciation to all country representatives here, to all ministers, to all partners, and especially our co-organizer, UNICEF, and our long-term friend since 45 years ago, the Almaty Declaration. Rahmat, and again, Khuta Bulsin. Thank you. I acted like the youth, actually, by having a pad on my hand, without it. Thank you.
Thank you, Dr. Tedros. Now, Dr. Hans, I would like to invite you here on the stage to sign the outcome statement. And please share your ideas or your takeaways on this rich day of discussions.
Dear friends, it's always an impossible duty to speak after my big brother, who was very, very comprehensive. So let me add something also, or add from the heart. I think what I felt today is a kind of can-do spirit, because we have to be, as the President was telling this morning, business-like and very, very pragmatic, from the actually words to the action. And that's why I'm very, very inspired, I must say, that the outcome statement is led by the youth, because again, 5 years ago, we were at this huge, beautiful podium also in the room in Astana, where we had this agreement. And I think nothing is more inspiring than you see, if you look back years later, that actually the things are moving forward. Because often we get into meetings and we say we're going to do and we're going to do something new, but then it does not happen. But realistic implementation strategies, I think, is the key, really. Leadership is essential. It starts with the leadership and the political commitment, but then to make it happening, to leave no one behind, to reach the unreached in the last mile, we only can do it through social participation. And if the youth is the equal partner in the health and well-being decision-making process, we are so much better off. Because ultimately, we're only going to create this culture of health if we unlock the potential in each of us. There's a lot of potential in each of us as an individual that we can unlock by empowering the communities to become resilient. And resilience means to bounce back stronger from the crisis. Because we still see a lot of inequities in the region, in the globe. So it's really our duty to work together, not only with health. Many of you told it, it depends on a lot of other sectors to tackle the social determinants of health, the commercial determinants of health, and we have to ensure that every person, independent of their socio-economic status, of their ethnicity, of their sexual orientation, all has equal access to secure housing, to nutritious food, to education, to affordable health care, and to a social safety net, particularly during the many emergencies that we are facing. And bringing the healthcare close to where the people live and are educated is through community care and primary health care. And I would like to specifically thank all the countries which took the enormous effort to fly here from outside our beautiful European region. I had so many exciting exchanges with delegations from Brazil, from China, from Ethiopia, from so many countries where we can learn a lot. Because in the European region, what we learned during the COVID-19 pandemic is that we have to be very, very modest and learn from all the regions, particularly on community care. Because unfortunately, in our region, we left a lot of elderly people behind during the COVID. And all the other regions have so many experience with community health workers, with social services, to leave no one behind. So I want to thank you. I hope to see all of you tonight, informally, but if I don't see you anymore, before you fly back, a safe road. We are one community, and with WHO, you never walk alone. Thank you.
Thank you so much, Hans, and thank you also on behalf of Melita and myself for really having been behind us to make this happen. We still have 3 speakers to go, so I'm going to have to ask you to be really short, but we've heard several times UNICEF being mentioned, so please, Octavian, kindly sign and a couple of words from your end.
To be extremely short. Excellencies, ladies and gentlemen, colleagues, friends, I have really 5 short messages. First, words of appreciation and thanks. First of all, to our hosts, Government of Kazakhstan, the Ministry of Health, for excellent organization of the conference, but also for the great hospitality. Our partners, the World Health Organization, for being a long-standing partner. Hans, as you said, WHO is always there, and nobody walks alone with WHO. Having both WHO and UNICEF, you walk with 2. So we're looking forward to continue this journey together as we started in 1978. Second is leadership. We've seen bold leadership in this room. Starting from the morning with the head of state, His Excellency President Tokayev, we've seen leadership in all high-level delegations represented in the meeting. We've seen leadership which is inspired by the declaration elaborated together with young people. This is leadership for the future. Third word which was used in every single session, it's investment. And we're looking forward that the investments in primary health care will continue irrespective of political tides of the moment. Finally, we heard that we need to bring primary health care closer to where people are, be it in their homes, in the digital spaces, in their communities. That's why the importance of community health work, of those that are reaching the last mile, is paramount. Today, we're not only reaffirming the importance of primary health care, but we're reaffirming our hope. And we heard through multiple examples that primary health care works, and that inspires us for more achievements together. And indeed, UNICEF is there, and you could always count on our partnership in this journey. Thank you very much. Rahmet.
Thank you very much. Now I would like to invite Dr. Chris Fearne, Minister of Health and Deputy Prime Minister of Malta, in his role as the President of the World Health Assembly, to sign the outcome statement and to say a few words on how member states will take forward these commitments.
What a fantastic day. Thank you so much, Minister Giniyat. A really, really well-organized meeting and a milestone in another feather in your cap and the milestone towards achieving primary health care. As President of the World Health Assembly, I can assure you, and I can assure all of you, that the member states and health ministers especially recognize the importance of primary health care. I mean, the jury is out. In this world of climate change, which is happening, in this world of antimicrobial resistance, in this world where we are finding difficulty in finding as many healthcare workers as we need to meet our demands, it is becoming more and more evidently clear that the way to universal healthcare is through primary healthcare. So primary healthcare is the key to universal healthcare, which is, of course, the key to wellness and to well-being. So the question remains, why, despite everybody knowing how important primary healthcare is in making sure our citizens receive the help that they need and that they remain healthy, why are we still not going the last 1 or 2 miles that we need to go, and why are the different regions around the world still not having 100% coverage when it comes to primary healthcare? And still today, a larger amount of our populations are still struggling to find the care that they need, even at the primary level. Why is this? The answers are many, and we discussed a lot of them today. But one of them, and as a scientist, I believe very strongly in this, is that we need the evidence to show that what we are doing is actually the correct thing. We are convinced of this. But the evidence will allow us to convince the rest of our colleagues in government and in society. To misquote a famous slogan, no brain, no gain. So we need to get our evidence, and we need to go out there and get the evidence. But one last point, and I close with this. One last point, and this has been made today during the meeting. We do not need to wait to have 100% of the evidence before we act. We have enough evidence. It is clear, it is obvious that the way to go is to go for full primary health care. So my message, my take-home message to the people in this conference today and those who are following us online is, pull your socks up, now is the time. This is not just about governance, this is not just about policies, this is not just about financing, this is about people. What we are doing here today, what we are reaffirming here today, will save lives, so let's get going and let's do it all together. Thank you very much and congratulations once more.
Thank you very much, Minister Fearne. And just before I call up our gracious hostess, Madam Minister Giniyat, to close this meeting, just allow me to thank the teams here in Kazakhstan, in the Ministry of Health, in the country office, in our GDO, the teams at headquarters, at the regional office. It was such a pleasure to work with all of you. So join me in giving all our teams a round of applause as we invite Madam Minister to officially close our day.
Достопочтенный доктор Тедрос Ghebreyesus, уважаемый доктор Ханс Kluge, уважаемые коллеги, дамы и господа. Мы завершаем эту знаменательную глобальную конференцию по первичной медико-санитарной помощи, посвященной 45-летию Алматинской декларации и 5-летию Астанинской декларации. Я стою перед вами с глубоким чувством благодарности за проделанную работу. Этот день стал свидетельством силы сотрудничества, обмена идеями и коллективной приверженности переосмыслению будущего ПМСП. Завершая эту конференцию, я прошу вас унести с собой дух общей ответственности и новую приверженность преобразованию ПМСП, который позволит нам добиться успехов, усиления национальных систем здравоохранения и укрепления здоровья населения. Пусть принципы, которые мы здесь обсудили, найдут выражение в практике, политике, способствующей равенству в области здравоохранения, в практиках, которые приоритетное внимание уделяется профилактической помощи и в системах, которые гибко реагируют на возникающие вызовы. Я с нетерпением жду возможности стать свидетелем позитивного воздействия наших коллективных усилий на здоровье, благополучие граждан наших стран. Еще раз позвольте всем выразить огромную благодарность за участие и приверженность к своему делу. Сегодня мы стали свидетелями важного исторического события, когда Астана стала столицей первичной медико-санитарной помощи по обсуждению политики и практики ПМСП. Астана открыла сердце для вас, представителей из 65 государств-членов ВОЗ, международных организаций, медицинских работников, экспертов, лидеров ПМСП, молодых ученых, студентов. После принятия декларации Астаны по ПМСП, Астана подтвердила свой статус центра обсуждения, принятия решений в области ПМСП. Астана приняла молодых специалистов, будущих лидеров ПМСП, волонтеров. Астана стала местом принятия итогового заявления и призыва к будущему ПМСП от молодых специалистов. Астана стала центром юбилейных событий в области здравоохранения. В этом году мы празднуем 75 лет ВОЗ, 45 лет декларации Алма-Аты, 5 лет декларации Астаны. Всю неделю Астана будет центром европейского здравоохранения по принятию решений в развитии систем здравоохранения европейского региона. Dear colleagues, let me express my deep gratitude to all of you adhering to the national Kazakh traditions. I sincerely thank you and say Rahmet. Rahmet to the countries and delegates for accepting our invitation and coming to Kazakhstan. Rahmet to all of you for your joint work, decisions, and achieved results. Rahmet to the WHO leadership for supporting the conference in Kazakhstan. Rahmet.